Do you really know which type of isolation applies to each infection? Because in the NCLES and in real nursing practice, knowing that can literally prevent an outbreak or protect a whole unit. Today, we're going to review in a simple and practical way the types of isolation, the common diseases, the personal protective equipment you must wear, and the correct order to put it on and take it off. So, if you are taking notes, stay focused. This topic is a favorite on the NCLES. Let's begin with the basics. Standard precautions. These are applied to every patient, every time, no matter their diagnosis. This means always perform hand hygiene before and after touching a patient. Wear gloves when there's any chance or in contact with blood or body fluids. Use a mask or face shield or gun if splashes are possible. And always disinfect patient equipment before using it again. An ankle tip, if you are not sure which isolation type to use, pick a standard precautions and make sure your answer includes hand hygiene and gloves. Now, let's move to contact precautions. These are for infections that spread through direct or indirect contact, like touching the patient or contaminated objects. PPE you must wear: gown and gloves. Use dedicated equipment. It means thermometer, blood pressure cuff, and a stethoscope just for the patient. Limit patient transport, and if you have to, cohort only with patients who have the same infection. To remember the main disease, use the acronym SCREWS. S for superbugs, it's mean methicillin-resistant staphylococcus or vancomycin-resistant enterococcus. C for conjunctivitis. R for RSV, respiratory syncytial virus. E for enteric infections like Clostridium difficile, norovirus, and rotavirus. W for wound infections, and S for skin infections. An inclusive tip: alcohol-based hand sanitizer does not kill Clostridium difficile spores. So when you see Clostridium difficile is in a question, the correct answer is hand washing with soap and water. Next, we have droplet precautions. This is for hairs sprayed by large droplets from cough, sneezes, or even talking. PPE, surgical mask, always. Eye protection, goggles or face shield like if it needed. Gown and gloves depending on the situation. If the patient must leave the room, they must wear a mask. Ideally, place them in a single room. Here's an easy way to remember the main diseases: Spider-Man. S from scarlet fever or streptococcal pharyngitis. P for parvovirus B19, pneumonia or pertussis. I for influenza. D for diphtheria. E for epiglottitis. R for rubella or rhinovirus. M for mumps, meningitis bacterial, and A for adenovirus. An inclusive tip: if the question describes cough, fever, sore throat, or respiratory droplets, think droplet precautions. Now, these are the most strict precautions, the airborne precautions. They are used for diseases that stay suspended in the air for long periods that can travel through tiny particles. The PPE we use is a fit-tested N95 respirator or higher, a gown and gloves if there's a risk of bloody fluid exposure, and the room setup, you have to place the patient in a negative pressure room with the door always closed. Limit the number of people entering that room, and if the patient must leave, put a surgical mask on them. To remember the common airborne diseases, think in TRVs, the three recreational vehicles. T for tuberculosis, R for rubella measles, V for varicella chickenpox, and S for SARS-CoV or smallpox. And inclusive, if the scenario says productive cough, weight loss, night sweats, and negative pressure room, the answer is airborne precautions for TBC. We already saw the isolation precautions, but what about the personal protective elements? Donning PPE is where order matters. Remember this sequence to protect yourself properly. First, the gun. Second, the mask or respirator. Third, the goggles or face shield. In this case, goggles. And fourth, the gloves. The gloves should always cover the ears for the gun. It's so important. And an inclusive, if you haven't put on all your PPE yet, don't enter the room. Wait until you are fully protected. Now, when doffing PPE, the goal is to avoid contaminating yourself. So the rule is simple. Remove the dirtiest items first and the face protection last. Here's the correct order. Gloves. Second, the goggles or the face shield. Third, the gown. And fourth, the mask or respirator. And always finish with a hand hygiene. No exceptions. A memory trick. Dirty first, respiratory last. That phrase will help you remember the correct order during the NCLEX. Let's summarize everything. If we're going to talk about isolation precautions, let's see. Standard, hand hygiene and gloves. Canted, gown and gloves. If we talk about Clostridium difficile, soap and water. Droplet, surgical mask and eye protection. Airborne, N95 respirator and negative pressure drum. And if we talk about EPP, donning, gown, mask, goggles, and gloves. And if we're gonna make Doffing, is gloves, goggles, gown, and mask. If you can recall this structure, you'll handle almost any NCLEX question on infection control with confidence. And that's it. You have just reviewed one of the most frequently tested and most important safety topic for the NCLEX, isolation precautions and PPE use. If you found this helpful, join our community at Enfermeras en USA, where we help nurses like you prepare the step-by-step for the NCLEX and your nursing career in the United States. Save this video, share with your colleagues, and follow us on all platforms for more lessons, tips, and NCLEX practice questions. See you in the next section, and remember, safety always starts with you.